This conference will now be recorded.
Good afternoon all. I welcome on behalf of Shreyas E-Learning Academy in the next session of our webinar series, Arsha. Today our guest speaker is Vaidya Akash Kembavi sir. He has completed his graduation in 1994 and he is a double gold medalist and university toppers for all the years. He has completed his MD from IGPTRA, Gujarat Ayurveda University in 1998. He has completed postgraduate EML Symbiosis University Pune. He has also completed MS Counseling and Psychotherapy. He is a director and consultant surgeon at the Ashtang Wellness Private Limited, Hubli, Karnataka. He is a professor and director of PG studies at SJG Ayurvedic Medical College and Hospital, Koppal, Karnataka. He has fistula and ano, varicose veins, diabetic foot, arterial ulcers, urinary tract diseases, prostate disorders and cancers. He is a visiting professor at the Thames Valley University, London. He is a subject associate editor at the ARMARC, the peer-reviewed journal of Ayurveda. He is a board member of Europe Ayurveda Academy, France. He has published the 9 articles and invited as a resource person at state, national and international seminars, conference and workshops. So without wasting much more time, I would like Dr. Kembavi sir to start his session. Thank you, sir.
Thank you. Thank you for the introduction and the opportunity given to me to share my thoughts and experiences on Shashti Upakrama in the management of Arshas. I hope I'm audible. Am I audible to everyone?
Yes, sir.
Okay, thank you. Right. So the topic given to me is Arsha, Shashti Upakrama. That itself in today's clinical practice seems a little bit odd because today when everybody who is qualifying out of your MS Ayurveda, the only thing that they would opt for is doing a hemorrhectomy or Kshara Sutra or Kshara Karma or whatever it is, even Agni Karma. So the use of Shashti, of course, they are a part of Shashti Upakrama, but what about the other components of Shashti Upakrama which are there, which can also be very effectively managed and employed in the management of Arshas. So different manifestations of Arshas. So having completed, when we were being trained in Jamnagar during those days from 1995 to 98, we could see the benefit and I think the advantage that we had was our HOD and Professor Kulwant Singh sir gave us a free hand and to do and to experiment, and to try out a few of the remedies, etc. But of course, that was only when we had gained his confidence that we can, diagnose and treat the conditions and be able to manage it. So we did a lot of these treatments and all the other experiences we have to share with you. So basically, what happens is, whenever a patient comes to us with hemorrhoids, when you diagnose it as hemorrhoids, I'm sure that throughout the series of this lecture, all of you must have heard extensively about the diagnosis, the clinical manifestations, the how to approach the case, what are the common complaints, what are the degrees. So I'm not going to go into all those details today. I'm going to restrict myself to only the approaches that we can adopt very effectively, because not everyone who comes to our clinic would like to be operated upon. So there is always that fear or anxiety. And if you're able to allay that fear, if you're able to give confidence to the patient that, okay, you did not worry. It's not always that, you should go ahead and start cutting. And when you say you are a surgeon, doesn't always necessarily mean that you have to, hold up your scalpel and blade and then start cutting. So that's not the case. So today, a lot of modalities are coming in management of hemorrhoids, right? So the latest one being the laser treatment, etc. But still, even with all these competitions, with all the modalities that are available, I feel that there is a lot of scope for the employment or the adoption of the Shashti Upakrama in the management of arshas. So let me just take you through the details. So what is the importance? So like I said, at a time when there are many treatment modalities available for management of arshas, I feel that the basic considerations as expected by our acharyas is being missed. When Sushruta talks about the 4 methods of treatment, and when Charaka extensively gives about all the other modalities of treatment, why are we not using them? Right? So there has to be some thought process has to begin, and we have to start using that. And like I shared with you, a surgeon does not always mean to cut and stitch. Why not explore the possibilities and offer them to our patients? So we can give, that itself by word of mouth. Sometimes, in our practice, I am basically known that when you go to him, he doesn't offer surgery in the very first instance. With that surgery, he can cure you. So these are the kind of things. These are the advantages I think that we can try and explore. I'm not saying that in every case that's the only thing, but as far as possible, we have to understand the concept first. What is the samprapti? Why does this person have this? Because remember, the person who is suffering from hemorrhoids, and the day that he has come to you will come to you only when he has developed some complications. So the first and the foremost thing is when they see blood. Right, that is the first thing that will alarm them. Or the masses have protruded to such an extent that it is causing some disability or restricted movements or discomfort. So those are the kind of things which bring up. And when I started using this, and with the training in Jamnagar, is that the Shashti Upakramas can be effectively adopted in clinical practice, not only in the management of arshas. The Shashti Upakramas are extensive guidelines which can be embedded in a lot of disease. Now, in the introduction, it was said that I practice. I also do wound management, diabetic foot management, and that is where peripheral vascular diseases, varicose veins. The Shashti Upakramas can be very. All the 60 have to be employed. It's a mix and match. So depending on the needs of the patient, we have to plan it. Now, what is important is it takes a little extra effort in understanding and adopting these measures. Right now, like with any other skill, this also brings with its own challenges, right? So how confident are you in diagnosis? How confident are you in because that is a patient, what the patient asks, right? So will I be okay? Will I need surgery tomorrow? Will I be able to, put off surgery? All those questions will come up. And most importantly, the satisfaction of having been able to offer something different from what all others are doing, and the patient's feedback is proof that these measures work. So obviously, the patient feedback and the growth, the number of patients who come to us, and basically the treatment and the relief that we are going to offer them. I think that should be most important, because today patient satisfaction and your approach is what should differentiate you. There is no point in you becoming a surgeon like anybody else. That is what I tell my students. Yes, if that is exactly what you want to become, you can go ahead and become. But then there has to be some difference in your approach. The way you take history, the way you do the examination, the way you offer the treatments, etc. If we also become like model surgeons, then I feel, yes, in certain instances we have to be. I'm not saying that we should not be like that. But I think the approach is very important. And that is what the patients will realize, that, okay, this is something which is going to give me relief. Now, why not try it? Because not, like I said, not everybody who comes to your clinic will want to get operated. Okay, that is not the case, because it brings with its own anxieties, isn't it? Even we, if something happens to us, we would not readily subject ourselves to surgery, being doctors ourselves, right? So we would like to try other options. We would like to see what are the medicines. We would like to see diet. We would like to see so many other things which are possible, and they are effective. It's not that they are not effective. They are extremely effective in the management. So why not use them? So these are the things which I learned long back, and then we have employed it in our clinical practice. So going ahead, now, facts I learned from researching what all we can learn is all acharyas have given elaborate description of these 60 measures in the management of arshas. Most importantly, the modalities are plenty and be employed very effectively. Now, there are not many practicing Ayurveda doctors who are willing to adopt these in their clinical practice. So this is something that we have to promote, right? So this is my concern, and this is the background, and this is the viewpoint that I have adopted in my practice, right? Because we were taught, because having worked with a lot of surgeons, etc., the first thing that we were taught is a good surgeon is one who knows when not to cut. Right? That is a teaching which was taught to us. So a good surgeon is one who knows when not to cut. That is very important, right? And if you have that mentality and if you have that view, I think then we can go on and offer a lot of other things which will help a lot of these patients. Yes. Now, very quickly, a reminder, right, of the 60 upakramas which are there. I'm not just going to read. This is from, as all of you know, from Sushruta Chikitsa first, right, 8th verse, which says that Tasya Vranasya Shashti Upakrama. So it is a Vrana. Now when you talk of the Vrana, now what is Vrana? Vrana is it necessarily a wound? Because Vrana Gatra Vichurnane, right? Wherever there is a disturbance in the bodily structures, that can be called as Vrana. So here Tadyata, Apatarpanam, Alepa, etc. The 60 upakramas are there, right from Apatarpana up to Raksha Vidhana. If you go through these, it is extensive list of treatments which are included. And I think it encompasses a very comprehensive modality of treatment, right? That is very important. So each of this, which includes Panchakarma, which includes the Ashtavida Shastra Karmas, right? Pre-operative, operative and post-operative. And then the concept, if you look at that, especially the later concepts like Brahmana, Vishagna, right? And Raksha Vidhana. Now these are concepts which people are talking now in modern science. They're talking of nutrition, they're talking of antiseptic measures, they're talking of antitoxic measures, etc. And Raksha Vidhana probably modern science is still yet to explore. But these are things that we can employ. In what way we have to employ is left to us. In what cases you want to employ is left to us. But all other procedures have their own beauty, have their own utility in a clinical management, right? So I'll not read the entire 60 measures because I'm going to take you through some of them which can be employed in hemorrhoids, right? So I will just present to you some of the karmas, some of the Shashti Upakramas, and I will show you images of which are the hemorrhoidal masses if they are there, what can be tried, what can be done, and what is the effect, right? So that is how we will proceed with the presentation. Now, just to quick recap, types of internal piles or hemorrhoids are, we generally grade them into four varieties, right? 4 grades: grade 1, grade 2, grade 3, and grade 4. So grade 1 is when, or first degree, second degree, third degree, and then in some textbook third, fourth degree, and then so first degree is when there is a hemorrhoidal mass may be there, but it is in the internal, or there is just a bleeder. So the patient comes to you with a bleeding history of bleeding. So when you do an examination, you may not see a mass actually, but there may be a bleeder or a very small mass which may be inside, right? When you do a proctoscopic examination, that's when you see it. It is not prolapsing outside. Now, when it is second degree hemorrhoids, so it bulges out while straining, and then it reduces spontaneously. So that is called as spontaneous reduction. So which means that the patient doesn't have to manually reduce it for it to go back. So it will go back automatically. So the patient will tell you, all these are very clear clinical picture which the patient will tell you. I feel that something is coming out, and then it goes back. Then if it still continues in the third degree where there is the prolapse, but that prolapse will not spontaneously reduce, it has to be manually reduced, which means that the patient has to push it back. So the patient will tell you, sir, as soon as I complete my the act of defecation, I can feel the masses, then I have to push it in with my fingers. So this is the practice that patients adopt. And then in the fourth degree, what happens is, or grade 4 is, what happens is, even in spite of manual reduction, they will still come out, which means that there is a lack of musculature, there is lack of support. By simple things, training, walking, by any simple activity, it will come out, right? So these are the possible manifestations that you can get in our clinical practice. So the patient can come to us in any of these stages, and we have to plan the treatment accordingly. So now let us go into the Shashti Upakramas, right? So Apatarpana. Okay, so if you look at this Apatarpana, now what does it say? It is a Adya Upakrama, it is the first Upakrama. And he says that Sarva Shvanam Samanya Karma or Krama. It is a Adya Upakrama, one of the first of the measures to be employed. It is a Pradhanatama. See, we have to give, we have to understand the value that this krama has been, or this procedure has been given by the acharya. He says it is pradhanapa, and then he gives the indications and contraindications. Now, with regards to the hemorrhoids, now if these are what he says, sarva shofanam samanya. So what do we call these are? These are called we can say that in terms of hemorrhoids, there is a condition which we call as inflamed hemorrhoids, obstructed hemorrhoids, or inflamed hemorrhoids. So when there is swelling, when the external hemorrhoids are also swollen, and there is a mucosal prolapse as well as the skin prolapse is there. So you can very clearly see in this image. So when the such image comes to us mind, what is the first thing that should come to our mind is, okay, this is a shofa. Can I apply apatarpana? Now when you say apatarpana, what does it mean? Apatarpana here means Deepana, Pachana, Langana. These are the procedures. So internally, why this is important? Because Sushruta very clearly mentions that the main cause, where does this samprapti start? He says that Visheshataha Mandagnehe. So the main causative factor, the root cause of Harsha is Mandagni. So due to the Mandagni, there is a dosha vitiation, and these doshas travel through the Adogami Dhamanis. From the Adogami Dhamanis, they come and settle down into the Vali, Guda Vali. And from the Guda Vali, they will start producing a Ankura, which we call as Mamsa Ankura, Harsha. Right? So where is the starting point? It is the Agni, which even Charak also highlights. I will show that to you in the last of the slides. So here, what does this indicate? This indicates that this person needs to be put on a very strict diet. You have to apply these principles. So Deepana, Langana Deepana, or Deepana Pachana, these measures. Externally also because it looks that there is swelling. So he says very clearly that Sarva Shofanam Samanya Krama. Sarva Shofa, not only this Vrana Shofa, Sarva Shofa, Samanya, Upakrama. So here, what do we advise? Now, this can be employed along with the measures that we are going to discuss later on. So internally, what is it that you have to advise? You have to advise a very easily light digestible food. Now, in our clinical practice, I will share, because Brahmana and Ahara form a part of the Shashti Upakrama. So if you get this picture, now we did this in Jamnagar. In Jamnagar, what we did was, as I discussed to you, whenever there is a case in a OPD or IPD in any hospital or any Ayurvedic college, as soon as we get this image, we say, okay, let's operate. Isn't it? That's the first thing that comes to your mind. Let's do some surgery. But then we said, okay, why not try? Because in Jamnagar, it is a free hospital. It is a central government sponsored. Patients get free food and everything. So what we did is, okay, let us try. Let us give him Lagu Supacha Ahara, Deepana Pachana Yukta Ahara, because that is what even Charaka says, Sushruta says, Vagbhata says. And then let us give him sits bath. Let us do Agni Deepana, Vatana Lomana, and let us try. So then we had to go to the kitchen, because that kitchen there in Jamnagar, they were not trained to prepare all these kind of foods. Yavagu, Yusha, Manda, Pay, etc., which are there. So we got that, and then we tried. We said that, okay, let us try. And if you do that, believe me, this is what we have been practicing now. These kind of masses, even though you can do a little bit of reduction, but they will reduce in size. The swelling, the angry look that you are seeing here will reduce. That will reduce. Right? So that is the pain will reduce, the swelling will reduce, the bowel movements will become normal, and then that the patient will be comfortable. Right? So edema can be reduced with the simple application of apatar. So Losupacha Ahara, medicine I'll discuss in the last. So what medicines that you can give internally, what we use in the condition. So this is apatarpana. Apatarpana has got a lot of role. Right? Use it very judiciously, use it very carefully, especially if, let us say, the patient is diabetic. Right? So in those instances, yes, there are challenges, there are limitations, there are indications, contraindications. We have to follow accordingly. But if you advise it correctly, then you can give very good. I'm not saying it will cure. Please remember, any of the Shashti Upakramas cannot be used as a straight away cure. Yes, in certain conditions, as we'll discuss later, they can be a cure. Now, what will happen here if you do this procedure coupled with, I'm not saying that, you see, one thing you have to remember is Shashti Upakrama, please remember that you have to use more than one Upakramas. It's not only one single Upakrama that we are going to use. It has to be a combination of many Kramas. So what combination can be used, we'll conclude later. But if this is used with other Upakramas, what will happen? The swelling will reduce, right? The inflammation will reduce, then the bile mass will shrink. And then the patient follows a strict routine of diet and exercise, etc., he will not have any problems later on in life. He'll be okay for next 5 years, 10 years, there will not be any problems. So you can avoid surgery, right? Because if I do surgery, I can earn so much of money. Yes, that is also one thing. I'm not saying, but can you think of a few patients where this can be adopted? Go ahead and do it. Then, Alep. See, if this is the presentation. Shoha uttita matreshu ugra rujeshu swa aushadha lepa. When he says swa aushadha, it means that vatahara, pittahara and kafahara. So look at the benefits. It does pralhadana, it does shodhana, it is shofahara, utsadhana, ropana. What is it that we want in Arsha? We want pralhadana. We don't want shodhana. We want shofahara. We want utsadhana. We want ropana. Healing. If there are ulcerated edges, if there are, angry looking, mucosal prolapse is there, why can't we try alepa? Alright? So vatahara dravya, pittahara dravya. If you see there is bleeding along with that, we can employ any pittahara dravyas. So Shruta said, you swa aushadha means what? Vatahara, pittahara, kafar. If it is a tridoshaja, then you mix and match. You see which symptom is more. If there is more burning, if there is more bleeding, go for tikta rasa pradhana dravyas because they are shita virya. They are cooling. And as soon as you apply, the patient will feel better. In what way? Alepa, you can apply through the media of taila, or you can apply as a kalka, or you can apply with the media of the ghrita, because ghrita and taila are also a part of the Shashti Upakramas. So mere application itself immediately will give relief. Right? And you can reduce it. The swelling will reduce. That is what in my clinical practice I've seen. Parisheka. See, now the presentation changes. Doshagni sahasaha shantihi. Very clearly it says Doshagni. That is, the doshas are burning the body. That is what Arivatta pranino himsati. Harsha. It kills you, it troubles you like an enemy. So that can be doused, that fire can be doused or extinguished with the help of Parisheka. Again here Parisheka Bikar, here you are seeing Pittaja. So do a Parisheka. That is, I told you, it takes effort. Right? You can call the patient, when you are doing like I'll share later on, you can call the patient every day. They will be willing to come to you every day for 3 days, 5 days, 7 days. Do Parisheka, do Apatarpana, do Alepa, then Parisheka. If it's a fissure, if it's bleeding, do Parisheka. With what? With the Haradaravyas. You prepare your own kashaya, Chandana, Ushira, Sariva, Mandishta, right? Shitavirya and Madhur Rasa Pradhana Dravyas you prepare. In such conditions, do Parisheka. Give relief to the patient. It will cure. Again, I would like to underline that. It is not a cure for hemorrhoids. The hemorrhoidal masses will not disappear. The masses will disappear only when there is surgery. But is there a possibility that with these treatments, you can reduce the size, they will go in, and then the patient can still continue a pretty healthy lifestyle. The quality of life will be there. The bowel movements are clear. There is no bleeding. There is no pain. There is no prolapse. If you can achieve that, why not try it? So this is Parisheka. Then Abhyanga. So where do you have to do Abhyanga? To give Bruduta and Doshopashama. What does it say? It says Dosha Upashama. So Abhyanga means what? Application of Taila or Ghrita. Say for example in a fissure, in the first image if you see here, it's a fissure. So if you apply Pichu, Jatyadi Pichu, Yashti Madhu Pichu, simple plain Ghrita Pichu also, if you just apply, that will give a lot of relief. It will do the Mruduta, it will do the Doshopashama. Even in hemorrhoidal mass. Right? We use xylogen jellies, etc. to push it. Now, if the second image that you see in the center, if this were to me, I am not going to operate on this patient on the very first day. What I would do is, I would try to reduce this. And it can reduce. Unless it is irreducible, then yes, go for surgery. If it is reducible, then apply Ghrita. Jatyadi Ghrita, Yashti Madhu Ghrita, or Jatyadi Taila. Just apply on this. And with your 2 fingers, index and the middle finger, you have to just apply a little bit of pressure and slowly coax the mass into it. Now, what you are seeing in the center, mucosal prolapse, and at the periphery is all skin, swollen skin. This is all normal skin, but now it is swollen. So once this mass goes in, what I do is I apply a T-bandage. So it stays inside. Next day only when the patient has to go to stools, it will come. It has to be removed. So you apply a T-bandage. Within 3 to 4 days, you will see that the entire swelling will reduce. And then you decide, okay, whether you want to do Kshara Karma, whether you want to do Agni Karma, whether you want to do the Kshara Sutra, or it is required or not also. So that way you can manage in certain cases. Because, sometimes patients are there who are totally anemic. They are not willing. They don't have any resources. You can try. No worries. Sweda, yes, very extensive treatment. Sweda. Where is it used? Wherever there is ruja, daruna, kathina. So what is the Sweda? We have to be interpreted as today in the clinical practice today. Sits bath, avagaha or parisheka. A modified form of parisheka can be called as avagaha Sweda. So sits bath has got extensive use. For the last 20 years, Panchavalkala Kwatachurna, the best of the sits bath medicine that I have used. Okay, whether it is external, this is the first one that you see, external thrombosed hemorrhoid. Right, so here if it is a thrombosed blood which is there, the clot has to be removed. But if you do a sits bath, it will come out. I have seen a lot of cases where it will just burst open. You don't even have to do surgeries. If the swelling is there, it will reduce. So sits bath has that quality, wherever there is pain, wherever there is darunata, hardness is there, kathinata is there, you can do sweda. Right? So nadi sweda also can be done, but still you can go, the best form of treatment is sits bath. So you can do once a day, twice a day, thrice a day. You can do that. So do sits bath and then do abhyanga. And then give lagu supachya ahara. In Jamnagar, when we were trained, every day, I remember, we used to go to the OPD, the treatment room at 8:30, and we used to come at 11:30 outside. What we used to do in first year, our only job was to assist our seniors in giving matravasti. Every day we used to give 60 to 100 matravastis. Minimum 60. Our job was to only fill the syringe in first 3-4 months. Just to see just imagine how many cases we would have seen. And then we were given the job. Okay, now you start doing the matravasti. Sits bath, matravasti. Sits bath, matravasti. Excellent results. But you have to do it. Get good quality Panchavalkala Kwathachurna. We get ourselves prepared and then you can try it. Panchavalkala Kwathachurna is the best that we have seen. We have not tried anything else, to be really honest with you. For the last 20 odd years that we have been practicing, Panchavalkala Kwathachurna is only one that sometimes we add Trifala. Otherwise, Panchavalkala gives excellent results. It shrinks the pile mass, it reduces the bleeding, it immediately arrests the pain, right? The sphincter will become lax. In fissure and in these conditions, the sphincter will be tight. That is what is the cause of the pain. In fissure, because it's at the peripheral, the nerve endings are there, it will be very painful. As soon as you give sits bath, there is a relaxation and the pain will reduce. You can see it on the face of the patient. The very second day you can see, right? Then Visravana. Now this is something that I have not tried, but this is an image that I have taken from this reference here, a study which was done. So yes, I have seen a few of my friends, 1 or 2 cases I have tried, but not very extensively due to some limitations. So this leech application is also tried. So you can see the change in the sizes, etc. So this paper, if you see, they have posted pre and post cases, and it gives excellent results. So Visravana, again here not bloodletting, but Jaloka Visravana can be used very, very, very nicely. So Visravana is also one of the measures which we can give, which we can use. Then, see, Sandhana Shonita Sthapana. So see, every image that you are seeing is a new case, right? Every image is showing you something different. So when you start seeing the images, the first thing that things should start coming to your mind. You should say, this is Vata Pradhana, this looks like Pitta Pradhana, this looks like Rakta Pradhana, this is this look at this looks angry. When you're seeing this, right? You can see the bleeders, you can see the congestion. And when there is a bleeding, you have to do Sandhana and the Shonita Sthapana. So Sandhana can be by ligation. Now that hemorrhoidectomy, etc. is there, where you cut. Now our barren band ligation or Shonita Sthapana. There are 4 methods which have been described by Sushruta. So you can try that. Internal medicines are given. So sits bath will arrest the bleeding. Now, many a times, like I told you, very important thing I would like to share with you is, many a times, because the Samprapti is Visheshata Mandagni and we have to do Vatanulomana, by just administration of Abhayaristam itself, the bleeding will be arrested. You don't have to give anything to arrest the bleeding. The bleeding is there because there is constipation and the patient strains. In our practice, we tell 2 important things to our patients. Number 1, never strain before you get an urge. The urge has to be such strong that as soon as you go to the toilet, the bowels have to start. That is the first thing. Never strain. The second thing is never withhold an urge. Never withhold an urge. When you get the urge, you have to go. Now that may be in the morning or in the afternoon. Whenever you get the urge, you have to go at that time. People today are saying, because we are so used to that routine, every morning I have to go. If I don't go, then I will not be comfortable throughout the day. All these psychological barriers are there. So what they do is they go and sit and then they strain, right? And today with all these Western commodes which have come in, which does not put pressure on the abdomen, that is causing much more problems. So we have to realize, right? And people today, they take mobiles, they take phone, they take books, etc. And the concentration is not on the act of defecation. So the intra-abdominal pressure has to rise. So if that doesn't come, then they should not go. They have to follow this. If they follow this, it's like training. And that itself will arrest the bleeding many of the times. If not, if the bleeding doesn't arrest, then yes, we have to go for other medicines. What are the medicines that we give to arrest the bleeding? Only two medicines which we have been using continuously and very effectively is Bolabadha Rasa and Chandrakala Rasa. 2 tablets TID, sometimes 3 tablets TID or 4 times a day. But these two medicines, Bolabadha Rasa, will immediately arrest the bleeding. Chandrakala Rasa, bleeding and swelling and the pain, burning, etc. will be taken away. So these two simple medicines can arrest. That has given us very good results. Okay. Chandra Prabhavati is also there, which we use extensively. Unfortunately, Chandra Prabhavati people think it's only for diabetes. This is how we are restricted ourselves in our practice. We are not ready to explore. We don't read the Falashruti, Harsha Vagandhavati. Right? So it has got a lot of, if you look at the ingredients, so therefore, please read, please research which are the medicines we can use. So when you look at this, what do you see? You see that there is red, angry look, bleeding. There are active bleeders, right? Congestion. So this is the condition where you have to do, because this is what brings the patient to the doctor. The moment they see blood, till the time blood comes, no matter the prolapse, because of embarrassment, because of ignorance, because of whatever the reason may be, they will not come, or they will try something, home remedies, they will go to some Vaidya here and there. Vaidya in the sense, a local traditional healer. They will go, they will try this, somebody told this, somebody did that, they wear copper rings, they do a lot of things. But the moment they see blood, that is when they get afraid, and then they come to us. Many a times it so happens that they have lost so much of blood that they are in anemia, severe anemia sometimes. So that is also a possibility. So we have to weigh. It's not that because it is there, when in every case of bleeding, no. If the patient is having severe anemia, then the management protocol has to change. Obviously, you cannot take the patient for surgery immediately. You have to do blood transfusion, and so meanwhile you can do all this. You have to arrest the bleeding, right? Then Sarpi and Taila. So that is what it is. Acute fissure in right, prolapse, pile mass, internal hemorrhoids. In all these conditions, please start using Taila and Sarpi. Simple Ghrita. Start with simple Ghrita. Good quality Ghrita, right? So Ghrita, simple Ghrita, or Jatyadita, or Yashti Madhu Ghrita. These are the Ghrithas that we use. Or you can use Mahatiktaka Ghrita, because it is Pitara. So Mahatiktaka Ghrita, then simple Ghrita, Jatyadi Ghrita, Yashti. You can mix and match. Or you can use Shatadhauta Ghrita, where there is burning, Shatadhauta Ghrita. These 4 or 5 Ghrithas, everyone should have in your clinic. Then Yashti Madhu Taila, Jatyadi Taila. Yashti Madhu Taila, Jatyadi. These are the only 2 Tailas that we use. We don't use Pipalyadi Taila, we don't use any other Taila. Kasi Sadi Taila. Many of them use Kasi Sadi Taila. But we have not found very good result. But we are very happy with Jatyadi Taila, Yashti Madhu. So we mix and match. Maybe sometimes 13 or 15 ml of this, 15 ml of that. If the burning is more, add more Yashti Madhu. So by just simple Pichu Dharana every day, right? Many of these conditions can be alleviated. I'm not saying cured, but you can control the condition, the pain, the burning. That is what causing the pain. So sometimes patient needs time to manage and arrange for everything. So till that time you can give relief. The congestion can be taken away. So 2 to 3 times a day you can apply. No issues. Absolutely no problem. Especially in fissure, etc. This works wonders. Sarpi and the Taila. Then Dhupana Vishagna. See, every case that I'm showing you is different. Okay, there is no repetition. So you see here, this is already it is going into complications. The one on your right, extreme right here, right? So there is a lot of slough. Now in swelling also, can do dhupana, krimic. I have added 3. There are 3 kremas here: dhupana, krimigna, and vishagna, because the medicines are overlapping. The medicines that we use in these conditions are overlapping. So what do we use for dhupana? Decide on the condition. If there is a vata hara, if it is pitta pradhana, pitta hara dhupana, how it can be given? You have seen how for pregnant women the dhupana is given. The same way this can be given. Krimigna. So Krimigna medicines can be added to that. So Nimba is there, Karanja is there, Guggulu is there, Agaru, Sarjarasa. All these medicines can be very effectively used, and it actually reduces. Even in diabetic foot ulcers where there is a lot of slough, if you do the dhupana, etc., it gives a lot of relief. Try it. Don't take my word for it. I have tried it. I have got relief. Right? I have got relief in my patients. They are happy with these treatments. So try it. Okay? Learn. So at least 1 or 2 cases, just try and do it. You will only see the benefit of these things, right? And it will give you confidence that yes, these things work. And it will open up your thought processes also. A lot of things will open. Kshar, Agni Karma, I'm sure that this must have been talked in detail in the presentations, different modalities, surgical approaches, etc. were talked. Yes, so this Kshara and Agni Karma, we can say that this has become the bread and butter. Now laser has become the bread and butter also. Many a times that is also being extensively used. Yes, so this also has its own place, because Sushruta very clearly says that there are 4 methods of treatment, and for each condition of the hemorrhoids, there is one protocol which has to be followed. So yes, you can go ahead, this Kshara Sutra, then Kshara Karma. Right? Both can be applied here. Both can be thought of. I am not going to details about these things. Basti. Yes. So Matra Basti. Like I told you, Matra Basti. Very effective, excellent remedy in the management of fissure, and even in bleeding piles and in piles also. You just start doing this. I still remember our sir, Professor Kullan Singh, he used to put in not less than 250 to 300 ml of warm water, just warm water. Basti. And patients would be so happy. They would pass bubble, they would be so comfortable. Right? So try Matra Basti. In our clinic, I'll show you for the last 20 years, 7 days of Matra Basti. Excellent results. Very second, third day, you can get very good results in fissure, burning, acute fissure, right? Bleeding, everything will be stopped. So select a 6-number catheter, red rubber catheter, 6 number, small. Okay, lubricate it properly, and like the catheter is shown there, with the oil, etc., push it. What oil do I use? I shared with you. Jatayadi Taila, Eshti Madhu Taila. We use Jatayadi Taila from Kottakal. It is prepared with the coconut oil base. Jatayadi Kera Taila. Excellent results. Excellent results. Every day the patient can come. And what happens is, like I told you, in the first day, whenever there is a fissure, acute fissure, there will be sphincter will have gone into spasm. So please don't try for doing a PR examination. Sometimes even the mere administration of the introduction of the catheter itself will cause pain. So maybe you can apply a little bit of a jelly, right? Zalocaine jelly if it is too painful, the patient is sensitive, or just apply some grita and taila and keep a pichu and let the patient sleep for 5 minutes. And ask the patient to open the mouth and take deep breaths. Open the mouth and take. The moment the patient opens the mouth and take deep breaths, the anal sphincter relaxes. If he holds his mouth tightly, then the anal sphincter will go into spasm. So ask them to lie in a left lateral position with the upper leg, which is the right leg, drawn up to the chest. That is the position you have to give them. Gradually introduce the catheter. How much? 4 angulis is sufficient. You can know. Initially there will be obstruction, there will be some resistance. The moment you cross the resistance, you are in the rectal cavity. So that is very neat push. So 30 ml, start with 30 ml of Matra Basti. Because on the very first day, because the body is not used to it, sometimes even immediately after giving Basti, the patient may have a bowel movement. And obviously when you are doing this, the foot end of the bed has to be elevated, or the head end should be low. Make the patient sleep on the couch for minimum 30 minutes, 15 to 20 or 30 minutes, compulsory. This is what we follow. They have to, otherwise it will not get retained. It should not come out. Remember, Matra Basti, the idea here is it has to stay there, lubricate there, heal, and there is no point in it coming out. Yes, the first day, second day, the patient will get the Pratyagamana after say 2 hours, 3 hours, 4, whatever. You tell the patient, whenever it comes out, let it come. Okay? And also know the color of your oils. Because you have to tell the patient when you go to pass bowels, sometimes you can see only the oil coming out. So it may be green colored oil, red colored. The patient should not get anxious, or they should not feel afraid. What is this coming out? Right? So please tell these kind of things. And when you try this, so what we do is we do this first, second, third day. By the time they are coming to third day, majority of the patients, you can see the change in the facial expression, the way they walk, they're comfortable. Then what we do, we go for anal manual dilatations. There are dilators available. Slowly we dilate it. Very careful. Again, now today it is contraindicated. Not many people do it, but this is what we have been doing. And then you continue for another 3-4 days. So 7 days Matravasi. In very few patients we have given Matravasi for 10 days or 15 days. But 7 days is excellent results. So so morning when they pass the bowels, ask them to come on. Because it's a Matra or Anuvasana Basti, they can have a little bit of breakfast, but still we advise them to come on empty stomach. Then have a sitz bath and then come in the morning hours. Now nowadays what happens, because of work schedule, right? They say, you cannot give a basti and then they cannot go on working and traveling, because then there will be pratyagamana. Then they may not find a restroom or a toilet. So many times when to just adopt, then what we have done is we call them in the evenings when they're going home. So what we tell them is you have to come here, lie down for about 15-20 minutes and then go home and then take rest for about another half an hour. So they will pass the bowels next morning and they're very comfortable. So basti in acute fissure in first degree piles, second and third degree piles, excellent results, right? You can alleviate the symptom. Brahmana and Ahara, this is very important. Okay, very, very important. Otherwise you have to give your patient. They cannot eat anything and everything. Okay. Now this is just an image that I picked up from the web, but what we advise, a very strict no is yogurt, curds. No curds, absolutely. Okay, no tomatoes, no potatoes, no brinjal, no green chilies, no coconut. Okay, no fried foods, oily foods, bakery foods, pastries, fast foods, etc. All these junk category foods, no. Okay, all these are strict. Not at least for 15 days, they have to completely leave it. What they have to take instead? They can have whole grains, right? Chapati or jowar, something which has got fiber in it. A lot of green leafy vegetables. Apart from brinjal, potato and tomato, they can eat other vegetables. Beetroots are good, carrots are good, beans are good. All these things they can eat. They can eat khichdi. Okay, bananas again today we have to be aware, because then there will be chemically ripened bananas. So you get those small variety of bananas. Now all this advice depends on comorbidities also. Because today a lot of patients have got diabetes, hypertension, thyroid, so many other things are there. You have to advise them correctly. Water intake has to be regulated. Warm water has to be advised to the patient. Very important. Minimum 1.5 to 2 liters of water is what we advise every day to be taken. So water intake is very important. Then takra. Instead of yogurt or curds, you ask them to prepare chas or takra, what is called as. Okay? That they can drink. Most importantly, what in our practice we have seen is many patients do not eat properly for fear of going to the toilet. So they feel that if they eat, then they will get an urge to go to the toilet, and if they go to the toilet, it will cause pain and burning and bleeding. So they stop eating, or they eat less, and that is very dangerous. Why? Because if you don't eat, the bulk is not formed. Isn't it? Your stool bulk is not formed if you don't eat. So if your bulk is not formed, then it means that you are going to strain. So if you strain, whatever we have been doing so far is useless. Isn't it? So you have to advise. The most important thing we tell the patient is have a proper meal. Breakfast, lunch and dinner. Very important. But little quantity. And then in between breakfast and lunch, something to drink. Maybe a buttermilk. Then in between lunch and dinner, eat a fruit. They can eat an apple, right? Or a banana. Or they can carry salads with them. Cucumber, carrot, beetroot. That they can eat. If they don't feel like eating anything, just drink water. See, it's like our Agni, our Agni has to be fueled. It's like a fuel, right? You remember Yajna or Homa. Every now and then we have to pour ghee into it. I cannot make it too strong, nor you can allow it to become too low. That is dangerous. So we have to educate the patient. So Brahmana and Ahara are a very integral part of the Shashti Upakrama, which we have to very effectively employ. This is not done in modern science. There are nutritionists, Ayurvedic doctors themselves are nutritionists. I think that this has to be developed into a whole different science, nutrition in Ayurveda or Ahara in Ayurveda. Because you know that Pathe sati gadarthasya kim aushadam, pathe asati gadarthasya kim aushadam. So diet plays a very, because today the patient will be better. What about tomorrow? The first question that everybody asks is, how long should I follow this diet? As long as you want to stay healthy, you have to follow this diet. Every now and then, occasionally, yes, it's okay. What about smoking, alcohol? Everything has to be cut. I'll share a case. We had a boy who was about 20 years old, and he came to us with bleeding per rectum. Acute fissure and bleeding per rectum. So when we inquired, what we found was this boy he had come from a different place and for studies to Hubli, and he started going to a gym. And when he started going to a gym, the gym instructor there, because he wanted to build muscle, he said that start eating egg whites. How many egg whites a day? 16 egg whites a day. 16. And this boy who was a pure vegetarian family, he started eating eggs. 16 eggs a day. Egg whites he used to drink. And he landed up. Within 15 days, he landed up. And his father came and he said, sir, look at this boy, what has he done to himself? So these are all the things, that is why, we have to remember. Another thing I'll share you is that there is a very close, 20 years of practice. What we observed is what Charaka and Sushruta, because Visheshata Mandagne, very important, colitis, right, acidity, and Arsha, Atisara, all these are integrally related. That is what I'll share it to you. So, yes, so I'll just share that later. But yes, Brahmana and Ahar, very important aspect of our clinical practice. This is our weapon. This is our something very important, especially in Arsha. Toilet training is very important. Diet training is very important. Vihara is very important. Adopt yoga, Pavana Muktasana, right? Many things. There are a lot of things which people do wrong today. They read somewhere, they see on YouTube, they experiment a lot of things without really understanding. And if we adopt this, then I think that we can do wonders. So like I told you, this is just a list of the medicine that we use in our clinic. Churnas, Panchavalkara, Trifala, Avipattikara and Hingvashtaka. Or laxative, Deepana Pachana, Vatanlomana. Guti Vati, Arogyavardhini Vati we use. Trifla Gugulu in painful conditions, external swelling, etc. Kanchanar Gugulu. Chandra Prabhavati and Kamaduga we use extensively. Sutta Shekara Rasa, Bolabadda and Chandrakala I already told you. And these two are the patent proprietary medicines. Tablet Pharmalax, it's giving us fantastic results. Where any kind of constipation can be cured with that. And tablet or liquid Nerosil from Solomix company. This is one of the medicines which is promoted generally as a liver tonic, but as an antiviral also. But we have seen, especially in children, even in adults also, unless they are diabetic, if you give the liquid, especially in elderly individuals have got the peristaltic movements have become lax, and there is no movement. And Nerosil works wonders. Excellent results we have got with Nerosil. Tablet is not as effective as liquid, but liquids in children, especially in bowel problems, in appetite, digestion, even in jaundice, etc., use excellent. It contains Bhumyamlaki, but it works wonders. Nerosil is something which we can swear it, and we use extensively in our practice. Asavarishta, Abhayarishtha, Mustarishta, Kudajarishta. Again, the indications Abhayarishtha. If you want to do Vatana Lomana, Deepana Pachana, Mustarishta, where you see there is a mucoid, whenever there is colitis, etc. Kutajarishta is indicated when there is Ardrarshas, that is when there is bleeding. But we don't use Kutajarishta, we use Bolabadda and Chandrakalarsa. There is also Patrangasa, which is there, which can be used. But Chandanasa, Ushirasa, Sarivadya, so we can mix and match. Not that you have to give only alone. What we do is, okay, we mix in 100 ml, 30 ml Chandana, 30 ml Ushira, 30 ml Sarivadya, or 40 ml. So you can mix and match and you can give. That gives good results. Jatadi Grita, Taila, Yashtimadu Taila Grita, Changeri Grita, wherever there is prolapse, in all the other conditions that I showed you, there is prolapse, to reduce and to do that, Changeri Grita can be given. Changeri Grita Basti also we give. Dadimadi Grita is indicated. Mahatiktaka Grita and Shatatavata Grita. And in Layhams, we use Kushmanda Rasayana as a Vatanulomaka, as a Balya Rasayana, Brahmana, Ahara. So Kushmanda Rasayana is a very good medicine that we use. So these are simple medicines in hemorrhoids, in fissure, whether it is first degree, second degree, third degree, fourth degree, or in acute fissure. This is all that you will need. You don't need extensive medicines, right? With this only you can practice very beautifully in your practice. So a very quick recap before we end, again based on Charaka's Arsha Chikitsa, right? So what this is in Charaka Chikitsa 14, Arsha Chikitsa. See, these are the modalities he has given. Abhyanga, Dhuma, Avagaha, Pralepa, Shonita Sthapana, Deepana Pachana, Pana, Anna. Especially he has given the stress on Takrapa Yoga, Takrarishta, and then Basti. If we use this only, then we can give fantastic results. Then he says that there are only two things that you need to do in Arshas. One is Vatanulomana, one is Agnibala Vruddhi. And there are three conditions which are interrelated. He says Prayaha Trayo Vikaranam, Praspara Hetavaha, Grahani, Arsha and Atisar. So there is they are interconnected, especially Grahani and Arsha. Right? And Grahani, Atisari Nivritte Api Mandagni Rahitashano. That leads to Grahani. So Atisara, Grahani and Arsha, they are inter. So in 80% of our cases, you see there is some kind of colitis, colon disorder. Whether it is Vataja, Pittaja or Kafaja, Grahani, that we can decide. But Grahani involvement is definitely there because that is Pittasthana. And Sushruta also very clear is being a surgeon, he says that Visheshata Mandagno. Mandagni is there. So he says, what does Charaka also say? Vatanulomana and Agnibala Vruddhi. These are the principles that we have to follow. You should never forget them. And if you follow this, you will get very good results. So look at this. Abhyanga, Dhuma, Avagahana. In Avagaha, what it says? Prakshalana. Right? Prakshalana. Then Pralepa. Shonita Sthapana. So lot of medicines have been given. If you go through Charaka, he extensively, more than Sushruta has given the medicines for Abhyanga, Dhuma, etc. So try it out. See whether what can work in your patient. Because remember, after 20 odd years of practice, every patient who comes to us has got a different manifestation. One pile mass is different than the other pile mass. So every patient is a new patient. Treat as though each patient is a new patient. Take detailed history. We spend minimum, when they come for the first consultation, we spend minimum 45 minutes to 1 hour in our consultations. We go through all the details. So it's like a, Janma Kundali, like a horoscope. Take all the details. Diet. Okay, what time you have breakfast? Why do you have breakfast at that time? What is the problem? So we ask them to change the time. Right? What do you eat? Lunch, dinner, snacks, everything, all details. You have to go through that. That is what Ayurveda, that is where you have to differentiate yourself from others. So your approach is very important. Once you do that, then what you have to do is you have to write down the Samprapti Khatakas. Then you will know, exactly. Before you take this, this is what we have been taught. If you take proper history, by the time you take the patient to the examination table, you will know what to expect. Okay? If it is fissure, painful defecation, constipation, painful defecation, burning defecation, which is persistent to about 15 minutes, 20 minutes, 30 minutes, 1 hour, 2 hours. If that is the case, straight away you can think it's a fissure. If it's a male, most commonly posterior fissure. If it's a female, most commonly anterior fissure. Even before you take the patient to the table, you can know it. Piles, no pain, unless complicated. Thrombosed, obstructed piles are painful. Otherwise, piles are not painful. So there will be only swelling, there will be prolapse, there will be bleeding, itching will be there. Itching is a main, because why? Because if it is a mucosal prolapse, not external, internal hemorrhoids which come out. When there is a mucosal prolapse, the mucus will stick to the sides of the anal verge and that will cause itching, pruritus. So there will be itching, there will be prolapse, there will be, the pain will not be there unless complicated. Remember, pain will not be there unless the hemorrhoid mass is complicated. By the way they walk, that itself will tell you how, and by the way they sit. If it is too painful, they will not sit comfortably on the chair, they will sit on the edge of the chair. Or they will remain standing and look at their face. You can know the extent of the pain. That is what visual unlock scale is. From a scale of 0 to 10, 0 is it's a smiling face, 10 is a hugely painful face. You can absolutely know the extent of the pain. You don't need to ask the patient also. So all these things will fall in place if you do the first few steps, which I'm sure I was covered. That's why I didn't touch upon it. The history taking, examination methods, and then investigations, whatever has to be done, then the treatment plan. So this is a recap, right? So Shashti Upakramas, predominantly we can use all of these things in combination in 1 or 2 or all of them together depending on the condition, right? And then we can effectively manage the condition. So lastly, I would like to say, right? So what he says, look, that just like there is this cartoon, right? This medicine is the best way to treat your hemorrhoids. And this person is stating, well, I don't think they deserve a treat, right? That is what Harsha means, Arivat. So you don't have to treat your hemorrhoids. If this word treat has been misunderstood by him. He is saying that treat means it's a party. So he says it's troubling me, so I don't want to treat them. I want you to take them out. So thank you all for this patient hearing and giving me an opportunity to share my views. And thank you to organizers for inviting me for this session. Hope I have done justice and I have covered whatever you are expecting me to cover. And thank you once again.
Thank you very much, sir. It was such a really nice presentation and also well experienced lecture from your side. And delegate who has doubts, please put their doubt in chat box so we can take more gist of your experience about hemorrhoids. Hello.
Yeah, hello.
Sir, there is one question that 4th degree hemorrhoids need surgery. But is there any experience that 3rd degree regressed only by medicine or any other method?
Yeah. So it will regress in size. Like I shared, it will not completely disappear, but the size will regress. Absolutely. No doubt about it. What I do is like I shared with you, I reduce the mass. And once you reduce the mass, you apply a T bandage. And once you apply a T bandage, and then after that, the 2nd and the 3rd day, the mass will shrink in size. Then you follow it up with Matravasti for 7 days or 10 days, like I shared, and the same internal medicine that you give. Most importantly, educate the patient, and they will regress in size. No doubt about it. There is no doubt. You can regress. The size will reduce. External piles, sentinel hemorrhoids, the sentinel piles, what we call as with the fissure. Sometimes they are so inflamed. Huge. See, remember, inflammation means what? It's the skin swelling which is there. The skin around that anal verge is a soft skin. There is a lot of what you call the lot of adipose tissue is there, and there is a lot of space. So the skin will swell. Now, if what I understood and what I have been taught is, if you cut at that point, you are likely to cut normal skin also. So it is better to shrink that and see the actual swelling which is there. Many a times we've got patients whose swelling is say as big as say amalaki, not the bigger amalaki, but the small amalaki which is there. So such big swellings are there. The what you call the sentinel pile masses or external. As soon as you start giving the sitz bath and other treatment, it will regress to the size of your the green gram or the tur dal, etc. It becomes so small. Then where is the need to do surgery? Right? There's one more question with, I can read it. Can I read an answer? Okay. History of diabetes and angioplasty having bleeding per annum due to 1st degree piles, perineal itching, loose and hard motion sometimes. Because there is angioplasty, remember you have to manage the constipation, loose and hard motion sometimes. So if there is loose motion, yes, go with Musta Arista. Of course, the patient is having diabetes, so make sure that you control the sugar. Remember, long-standing diabetes or if any patient is having diabetes, this is what we have seen in our experience, with more than 5 years, generally has got some constipation issues because that affects the peristaltic movement, so it will slow down that. So make sure that you are advising proper diet. Now, in this case, if there is bleeding, you can give Bolabhadra Rasa, Chandrakala Rasa, or even Chandra Prabhavati. Chandra Prabhavati will help him, no doubt about it. And if you are able to do a simple Matravasti, 10 to 15 ml Matravasti, or internally give him some Grudha with milk. Now, obviously, the patient has got angioplasty, so there will be some fear that due to the cholesterol blockage, etc., I may not be able to take. So, do some Matravasti for 3 days or 5 days. That will arrest the bleeding. No doubt about it. Please explain Matravasti dosage for fissure. I start with 30 ml. The first day I give 30 ml, second day 30 ml. Then you can increase the maximum. It's that I have given is 60 ml. I have not seen the need to give more than 60 ml, because then you see here, like I explained, the important thing is that you want the oil to stay in, right? There should not be any pratyagamana. That is how I understand it. The more it stays in the what you call the pakwashe or the antra, the more it heals. Right? So if you give more, it is not that they will heal better. If you give more, then they will have an urge, then it may actually not serve the purpose. So start with simple 30 ml and you can go up to 50 ml, 60 ml and maintain that dose. Thank you. Thank you everyone else who have given your feedback.
Thank you, sir.
Take down my number and other things. If there is any case that you want to discuss, please feel free to write to me on that number is my WhatsApp number. You can contact and I will try to help you to the best of my knowledge.
Sure, sir. Sure. We'll definitely coordinate with you if some of the delegates have any question regarding this topic. So once again, sir, on behalf of Shreyas E-Learning Academy and all delegates, we thank you for this your renewable and clinically applied session. Thank you, sir. Thank you very much.
Thank you. Thank you very much.